Hello, my name is Dr. Robert Shortell, and welcome to this brief video. I just want to discuss with you why chiropractic care is so unique and effective. Chiropractors work to improve the functioning of your nervous system. So what is your nervous system? On the left is an image that shows your nervous system. It is your brain in your head, your spinal cord in bright yellow, and then you see the nerves that branch off your spinal cord. And these nerves directly touch every single cell in your body. This is a network that allows your brain to control and coordinate every cell of your body in harmony. On the right is your skeleton. The parts we're interested in are your skull and spinal column. The thick skull protects your brain. The spine is composed of 4 areas. The area in blue is your neck and is composed of 7 bones. The area in orange is your midback and is composed of 12 bones, with a pair of ribs attached to each bone. The area in green is your lower back and has 5 bones. The last area in purple is your tailbone and is composed of your sacrum and coccyx. The main purpose of the skull and spine is to protect your nervous system from injury. The image on the left shows your nervous system and how it goes from your brain all the way to the tips of your fingers and toes. The image on the right shows how the nerves innervate and control the functioning of all the organs of your body. Only about 4% of all the nerves of your body deal with pain. This is an important point because when your nerves are being injured, the majority of the time it does not cause pain. It results in lowered function, such as eyes that are sensitive to light, dry mouth, breathing problems, heartburn or reflux, constipation, IBS, type 2 diabetes, bladder urgency, and sexual dysfunction. The image on the left shows what a normal spine should look like. From the front, it should be straight as an arrow. From the side, it normally should have 3 opposing but balanced curves that act like a spring, allowing your spine to be flexible and strong. The image on the right shows how these 2 bones are connected to your spine. Your spine balances on 3 points. You have a flexible disc in front, and in the back you have 2 bony facet joints. When aligned correctly, the facet joint can flex and extend naturally with no pain or limitation of motion. The image on the right shows how the flexible discs move naturally and painlessly when aligned correctly. When I'm helping people with neck conditions, I like to break up the neck into 3 parts: upper, middle, and lower. When I deal with upper neck injuries, the nerves in this area radiate into the head. These patients tend to also notice problems with different types of headaches such as migraines, sinus problems, TMJ, and also frequent dryness or irritation of the eyes. When patients have problems in the middle part of the neck, these nerves radiate to the side of the head and ears. They tend to notice tight trapezius muscles, feeling like they would like a shoulder massage, tension headaches, congested ears, and also ringing in the ears or tinnitus. Lastly, when I'm treating patients with lower neck injuries, these are the nerves that can radiate down into the shoulder blades and down to the arms and hands. Patients will often state difficulty when turning their head in the car, trouble sleeping, blaming it on a bad pillow, and a persistent dry cough. When I'm dealing with lower back injuries, I find that there are 3 main areas that cause lower back pain. The first one is in the image on the left. These are the joints of the spine. The common signs with pain in the joints is pain in the morning that slowly gets better as the morning goes on, and often pulling your knees to your chest relieves some of the pain. The second area of pain generation in the lower back involves the discs. This may be herniated, bulging, or degenerated discs. The common signs for a problem here is pain when sitting for a length of time, and often the back pain can extend down the leg in a condition called sciatica. The last common area that causes pain in the lower back is from the sacroiliac joint. This is the area that connects the base of the lower back to the pelvis. The common signs for a problem here are pain during transition movements, such as getting up from sitting, turning in bed, and working at a counter slightly leaning forward, as in cleaning the dishes or preparing a meal. When you lose the normal alignment of your spine, it may cause many problems. Some of the most common are poor flexibility from sitting too long at school or at work, bad posture that develops from our childhood. Also, sudden injuries such as whiplash can occur from car accidents and sporting injuries that tear the ligaments that connect the bones of the spine. When you injure the joints of your spine, this causes multiple problems such as degenerative changes like osteoarthritis. This causes more pain nerves to grow in the area, making the joint more painful and sensitive. These problems can also cause injuries to your discs, that are your flexible spaces between the bones. The most common injuries are degenerated discs, bulging discs, and herniated discs. But the number one cause of spinal problems are what are called subluxations. This is what chiropractors locate and fix in their patients. A subluxation is when the bones of your spine don't line up correctly, and this causes interference with the normal transmission of nerve impulses between the brain, organs, and tissue cells of the body. According to research, the weight of a dime interferes with 60% of a nerve's functioning ability. How much does a dime weigh? Very little, but that is how sensitive your nerves are to injury. And this can cause pain, but with only 4% of your nervous system dealing with pain, this happens only a minority of time. The majority, or 96% of the time, these subluxations result in impaired functioning to the rest of your body, such as impaired function to the organs of your body. The only way to fix these subluxations is through what is called a chiropractic adjustment. The adjustment is when a chiropractor will use gentle pressure to realign your spine with the goal of increasing normal range of motion, reducing nerve irritation, and improving overall body function. Because when your spine has full normal range of motion, this decreases your chances of arthritis, improves your flexibility and posture. It also improves the transmission of nerve information that goes into the head, down the arms, and down the legs. A flexible, healthy spine also improves the functioning of all the organs of your body. The last slide here shows the 3 phases of care. The first phase on the bottom is mainly there to help you reduce your pain and get back to the way you were feeling before your injury. The second phase in the middle is the rehabilitative phase, meant to strengthen the muscular system and repair the injured alignment of your spine. The last phase on top might be the most important. This is the phase where you see a chiropractor occasionally to make sure your changes stay in as best position as possible, so you can stay as healthy as possible. We are here to assist you in helping you regain your health naturally. I just wanted to say thank you so much for taking the time to watch this video, and I look forward to seeing you soon. Have a wonderful day.